All right. Welcome to tonight's presentation of Introduction to Lupus and Lupus Nephritis. My name is Lisa Klaslow, and I'm the Communication Relationship Manager here at LSI. Before we get started, we just want to make a couple of quick announcements. First one being the Chicago Marathon is going to be on October 10th. The Lupus Society has 19 runners, so we do have a lupus charity running team. So if you're out, cheer them on. They will be wearing designated jerseys, so you can't miss them. Also, Giving Tuesday is coming up. Hard to believe, but November 30th is Giving Tuesday this year. So please consider making a donation to LSI on that day. And then in a way future event, the LSI Associate Board will be hosting Stepping for Lupus Banquet April 29th. We are super excited to get this back on the calendar as this event has been postponed twice due to COVID. So we hope you bring out your dancing shoes and join us on April 29th. As we're getting ready for the event, I just want to make an announcement that this event is for educational and informational purposes only and to serve and benefit our mission. The Lupus Society of Illinois does not provide medical advice or recommendations. This information should not substitute or replace expert medical care. Before making changes to your medical care, consult your qualified healthcare professional familiar with your medical condition and health status. This event is being recorded and we will archive it on the Lupus Society of Illinois website. So if you miss anything or want to go back, we will be sending it out and posting it onto our website. If you do have questions, we will have time for a Q&A at the end. So if you want, you can put them in the chat box, or if you want, you could email Torian Jackson. His email is taurean@lupusil.org, and we will make sure we get to your questions at the end. Tonight, our presenter is Aliciee Griffith. She is a registered nurse. Aliciee Griffith. She is a registered nurse and patient engagement liaison for GSK Pharmaceutical Company. She graduated from the University of Tennessee in Chattanooga with a bachelor's degree in nursing and psychology and began her nursing career over 30 years ago. She has worked in many patient care capacity and most recently is a pharmaceutical industry for 17 years. Her passion is for the well-being of all people drives her to work tirelessly and passionately impact those she encounters. She believes each opportunity to teach, listen, and exchange knowledge is an opportunity to help improve a life or lives. Her desire is for each and all of us to be our best authentic self. So with that, I am going to turn the presentation over to Aliciee.
Right. And let me see on sharing. Will you you'll give it to presenter for sharing my screen?
Yes.
Okay. Okay. Can everyone see my screen now?
I can.
Okay, great. So just to kind of reiterate a little bit of what Lisa just said, we are going to talk from the introduction to lupus tonight and lupus nephritis. And all the information that I'm sharing is for educational purposes. And I would like to reinforce that any treatment questions that you have, in particular health questions about your condition, I would ask you to refer back to your physician. I will answer questions at the end, but they will be generalized questions and not specific to your condition. So that being said, let's get started. Let's talk about what is lupus, and then we'll talk some about lupus nephritis. Now, I see there's about 15 folks or so that's on the call tonight, and I'd like to ask a question of how many people on the call are newly diagnosed with lupus? And I guess you can put, is there a chat box that I was trying to see here to just get a count, but maybe not.
You have a chat box.
Okay. So yeah, if we have an idea how many people are newly diagnosed, or do we have mainly folks that have had lupus for a while? One newly diagnosed I see coming up. Okay. Okay, great. So let's move forward. There we go. So I'm going to start by talking about the basics about lupus, understanding lupus, the immune system. We'll go over some details about that. I'll share some signs and symptoms of lupus. Then we'll go into information about lupus nephritis and the lifestyle management for lupus. So speaking of the basics about lupus, what I would like to share is we know that lupus 1 is a chronic disease. And when we talk about what a chronic disease is, that means that you've been diagnosed with lupus for 3 months or longer, and also that there's no cure for lupus. There's no cure for chronic diseases that we have at this point in time. We know that it is an autoimmune disease, which means the immune system is not recognizing its own healthy cells as that, and it starts to attack its own healthy cells. And then in addition, lupus is usually covered by periods of when you have periods of remission, which we would love for you to stay in the majority of the time, and then periods of when you have what we refer to as flares. Sometimes I like to say, people say that the disease waxes and wanes. I like to refer to it as a squirrely disease. And the reason I describe it as a squirrely disease is because lupus is all over the place. It's kind of like a squirrel that jumps all over the place. So sometimes it presents itself maybe with your skin. That's a frequent, easy one that we can identify. And the next time that it presents itself, it may be present itself with inflammation in your knees, or it might be GI problems that you're experiencing, things that you can't see. So that's why I say it's a squirrely disease. When we think about who has lupus, there's 1.5 million people in the United States living with some form of lupus. So I'm talking about systemic lupus erythematosus tonight, but there's also cutaneous lupus, there's neonatal lupus, and there's drug-induced lupus. So there's several different forms of lupus. We know that 80% of women are diagnosed, or I'm sorry, 90% of women are diagnosed with lupus, and it's usually between the ages of 15 and 44, but these are not solid numbers. We do know that you can get lupus at an earlier age, and you can be diagnosed with lupus at a later age. We still don't understand why you get lupus. We don't necessarily know who, but we do know that there are some factors that have been identified, and those factors are hormones, genetics, and environment. So we say women get lupus 90% of the time. That means 10% of the time it is men who are diagnosed with lupus. And when men are diagnosed with lupus, a lot of times it's a more severe form. So let's talk a little bit about the immune system and what does the immune system does. The immune system's job is to fight off infections, foreign invaders, we call them antigens. All of those are bacteria or fungi or infection, anything that is not natural in our body. The immune system's job is to identify that this is not supposed to be here, form antibodies against it, and fight it off. Fight off all of those invaders. That's when the immune system is working correctly, the way it was designed to work. But with lupus, your immune system, it has a difficult time telling the difference between your own healthy cells and those foreign invaders, those bacteria. And the autoantibodies are developed when we start fighting our own self, as I say. And another word that I like to use often is when your body is having an allergic reaction to itself, because that's what it kind of seems like when you're developing inflammation and you're having pain in parts of your body that there's no infection going on that's caused from an outside source. We know that some of the effects of lupus are visible and other effects of lupus are invisible to the eye, meaning that you can't see it outwardly. I know a colleague of mine said that they saw a t-shirt that once said, "You don't look sick." And on the back of it, she said the t-shirt read, "And you don't look stupid." So what we mean by that is just because you don't look sick, we know doesn't mean that you're not sick. Just because you can't see what's going on doesn't mean that there's not something going on. with you. So that covers our basics about lupus and the immune system. So let's talk about signs and symptoms, ways that you can recognize when you're having a flare and what you can do about it. So one of the things that I talked about is physical symptoms are those symptoms that are visible to you and that can be seen on the outside of the body. And oftentimes we refer to one, the butterfly rash, which comes across the bridge of the nose. That rash is also, the professional name for it is a malar rash. That's something that's visible. You may have sores in your mouth, you may have joint pain or swelling, hair loss, and changes in your weight. That can be weight gain or loss. All of those are physical symptoms of lupus that you can see. But there are also those symptoms of lupus that are invisible symptoms. These are the ones that are quite alarming because a lot of times they can cause organ damage. There's things going on in our body like the inflammation in our kidneys that can cause blood or protein to be spilled over the urine, or signs that your lupus is flaring, that you're having active lupus disease. And infections in the heart are another, or even in the lungs are another example. A chest pain that you're having caused from that inflammation around your heart, or infection or inflammation around your lungs because the inflammation is pushing in on your heart or your lungs. Fatigue is another symptom that you can't put your finger on, but we do know when you experience fatigue with lupus, it's an abnormal level of fatigue. It's not a take a 15-minute nap and you feel so much better. And we know that 80 to 90% of people living with lupus experience fatigue at a level that's beyond the normal level of fatigue, or what we would consider normal. You also may experience some neurological effects with invisible signs of lupus. And the one that we talk about, and I'll come back to it in a little bit, is brain fog. But you also may have a headache. You may experience some seizures or stroke or neuropathic examples of that also. Now, when we talk about brain fog, we know that 50 to 80% of people may experience brain fog. And brain fog is when you're having problems memorizing things or with your memory. You may have periods of confusion, and you just may not be able to concentrate. An example of brain fog may be you get up to go into the kitchen to get water, and as you're walking to the kitchen, you can't remember what you were going for. Now, sometimes I like to say that might be a result of the aging process. We all begin to forget things. And depending on how stressed we are, we forget things. But if this is happening on a regular basis, like on a daily basis, if you notice, but any type of a regular basis, you know that it may be lupus fog. If you can't concentrate, or you just can't remember short periods of time, you may be experiencing brain fog, or lupus fog as we use. We have the Facebook website, usandlupus.com website, and there we have visitors, lupus warriors that come there, villagers as I refer to them, or your support systems. And this is a quote that was left by one of the lupus warriors. And they said lupus is definitely an invisible disease. Through it all, we have to keep pushing. And so that's one of the things we know that lupus warriors do. They keep pushing, they keep moving forward. And that's what we have to do to survive this cruel disease. So what signs and symptoms have you experienced? So if you take a moment to think about that, what signs and symptoms are you experiencing? And for those that have had lupus for a number of years, are there any new signs and symptoms that you're experiencing? Are those any symptoms that you need to talk to your physician about? So kind of think about that. So let's talk some about lupus nephritis, get a closer look at that. So what is lupus nephritis? Lupus nephritis is when you have swelling and irritation in your kidneys, and your kidneys aren't functioning correctly, and it's caused by your lupus. 35% of newly diagnosed adult lupus patients can have critical signs when it comes to lupus, and they may have a kidney involvement, clinical signs of kidney involvement. 40% of adult patients with lupus will develop lupus nephritis. And then up to 3/4 of children with SLE or lupus may develop a kidney involvement. So those are really high numbers, and that's something that we want to take note of. I know I have done this presentation before, and on the presentation when I did it once before, there was a lady on there that had been diagnosed with lupus for over 20 years, and she said that her physician had, to her knowledge, never checked her kidneys to see if her kidneys were involved with her lupus. So she went back in and talked with her physician, and he did do some studies on it and discovered for her, which was a blessing, that she still did not have kidney involvement. So that was a wonderful thing. So who gets lupus? We know that lupus happens more, like 3 times more in African Americans. It happens a couple of times more in Hispanics and in Asians compared to our Caucasian counterparts. So it happens more among people of color. And men are more likely to develop lupus nephritis than women. And I said that a little bit earlier. And we think that that's directly probably related to the fact that they're diagnosed at a later stage in their lupus journey, and therefore kidney involvement may already be there. So what do the kidneys do? The kidneys have a huge role. We know that kidneys remove waste and extra fluid from our bodies. When we say waste, that's anything that we're drinking in or that's in our body that's liquidy, that comes through the blood, that it can filter out, that is not good for us. The role of the kidneys also is to help control our blood pressure, and that's very important because controlling our blood pressure has an effect on our veins and our arteries and their ability to function too. Lupus also, the kidneys also create new red blood cells, and we know that red blood cells are very important to our survival. And then also the kidneys help the body to remain healthy and strong. And all of these are so very, very important for us. And then also it maintains the pH in our body, correct pH for your blood, the chemistry level in our bloodstream, in order for our blood to be able to nourish our tissues properly. Okay. So what happens to the kidneys when we have lupus nephritis? And lupus, one, causes scarring in the kidneys. And the thing about when we have scarring in the kidneys, that scarring is not repairable. Those are permanent damage. It's kind of like with our brain. When we start having damage in our brain, our body's not as able to repair damage there. When you have scarring in the kidneys, that's areas in your kidneys that are no longer working properly. So what is signs and symptoms of lupus nephritis? Well, that's when you have swelling in your feet. You can have swelling in your ankles, your legs, your hands, even around your eyes, and puffiness. That's a sign that you are retaining fluid, which means that your kidneys may not be working properly. High blood pressure is another sign that your kidneys are not working properly. When you do your blood test, you can see if you're having protein in your urine, or if you look at your if you have blood in your urine, you know that that's not good, or protein in your urine. And also, if your urine is what we call foamy or frothy, so if you think about, you put dishwashing liquid in your water and it bubbles up, if you have that kind of bubbling up foamy when you go to the bathroom to urinate, that's a sign that something's not right with your kidneys, your kidney function. And also, pay attention if you're having an increased need for urination, or you're having to go to bed, go to the bathroom more frequently, and especially at night. All these are signs that tell you your kidneys need to be checked by your physician to make sure everything is okay there, or to catch any signs early before you have a deficit. So there are classes, different levels of lupus nephritis, starting at class 1 and going all the way to class 6. Know that class 1 is a minimum amount of damage that is going on, that you're having some dysfunction there. But when you get to class 6, that means you're having severe kidney damage there, and you're going to need to talk to your doctor about what stage you're in, if you have lupus nephritis, and also about possibly doing a kidney biopsy, because that's one of the ways that they can tell the severity level of your lupus nephritis. So a kidney biopsy is something that your physician would do. So what you want to know, that untreated lupus nephritis can lead to scarring in the kidneys, which means you have serious kidney damage, your kidneys aren't functioning properly, they aren't filtering properly, and that can cause other problems within your body. Approximately 20% of patients with lupus nephritis will progress to dialysis or kidney dialysis, or even a kidney transplant within 10 years. So it's so important for you to manage your kidney disease, for your physicians to be checking your kidney function on a regular basis, because you don't want to progress to renal dialysis. You don't want to have to progress to a need for kidney transplant if that can be avoided. So again, from our Facebook page, the usandlupus.com webpage, one of our visitors said that they were diagnosed with lupus in 2015 and have had SLE and stage 2 kidney disease. And they said, you know, everyone knows their body better than anyone else, so pay attention to your triggers and your flares so that you can keep your physician informed of any changes that you may have. And also, it's so important to educate yourself. So the question that I'd like to pose to you, have you had discussions with your physician about your kidney function? Has he drawn blood work or gotten a urinalysis to determine whether or not you have any kidney involvement with your lupus? And is that something that needs to be considered? Are you having any of the signs and symptoms that I talked about? Any of the swelling in your hands or your ankles, or anything? A weight gain is another sign that you are retaining fluid, and those are going to the bathroom more frequently. All of these are things that if you notice is happening, you want to have a talk with your physician early rather than later. So let's talk about lupus lifestyle, or your lifestyle with living, how you can proactively manage your lupus. So I know if you heard me speak before, you've heard me talk a number of times about how important it is to monitor your symptoms. And that means tracking your symptoms, writing down in some way, health journaling. I talk about most frequently about writing down what symptoms and triggers, writing down your history, writing down the medications you're on, writing down your appointments, all of these, but monitoring your symptoms, recording how frequently these symptoms are happening, what severity level they are, so that you can report that to your physician. We know that nutrition is also key to managing your lupus, because good nutrients help to restore your body. And so eating healthy, we know that there's not a specific lupus diet, what diet you should be on, what you should be. And when we say diet, we're really talking about nutrition. We're not talking about dieting in the old terms that we used to. But what is your nutritional intake? What should you be eating? What is it your physician recommends for you not to be eating? Those are conversations that's very important for you to have. And in addition, you want to take time to de-stress. It says to sit back and reflect, self-reflection, but that's a way to de-stress. That's important for you to take some time, maybe for you to get quiet or get away from others and reflect about how your day was, how your lupus is. Are you having a flare? Are you stressed and need to delete something? Communication is also a very important way for you to manage your daily life with lupus, and that means communicating with family and friends about what's going on, along with communicating with your healthcare team. And also, you want to make sure that you're keeping those appointments and you're following your treatment regimen that your physician is recommending for you. Those are ways for you to remain as healthy as possible, and keeping those appointments anytime that you may have a specialist appointment outside of your normal physician, primary care, and rheumatologist. Any other specialist that you are seeing, you want to make sure that you're following up on those appointments as recommended by your physician. So when we talk about monitoring your symptoms, remember, most importantly, that every symptom matters. Sometimes we just kind of, when it comes to having a chronic disease, sometimes we just kind of accept this is what it is. But if you get in the habit of not mentioning what you're really experiencing with your lupus, then your physician can't give you a complete treatment plan. And so if your fatigue is still happening and he's thinking that you're not experiencing as much fatigue, then that's a challenge. But share all symptoms, because every symptom matters. It's also so important for you to be proactive in your care, to be engaged in your care. Any symptoms of lupus as a result of inflammation in your body is important, but be engaged and share with your physician. And again, I talked about health journaling. There's many ways that you can do that to keep track of your symptoms, but we do know that it's important for you to keep track. So when we talk about journaling with lupus nephritis, I'd like to share an additional key pieces of information that you may want to record when it comes to kidney functions and when it comes to whether or not you've been diagnosed with lupus nephritis. But monitoring your symptoms is so very important. So you want to keep a note of how much fluid intake you're taking. It says water here, but anything that you're drinking in, you want to keep note of. You also want to keep track of how often are you urinating. Are you going to the bathroom more frequently than normal or less frequently than normal? When you go, is there been a change in the color of your urine? Is there a change in as far as it foamy or frothy, or is there a change in the smell of it? Any of these things you want to make sure that you are sharing with your physician. And also, are you noticing a change in your blood pressure? Sometimes some of the most subtle symptoms happen with changes in blood pressure. I have high blood pressure, and one of the things that I notice when my blood pressure is up is my eyes turn red. So that's one of the biggest things that I notice if my blood pressure is up. And then the second thing, which is not a good one at all, is to have a headache. And when I've moved to a point of a headache, I know that my blood pressure is way, way, way too high. But noticing symptoms early. Also, another thing is if you have any unexplained swelling, that's something that you can take note of, because that means that your kidneys aren't filtering, getting rid of fluid as they should. So recording your weight is so important, because if you have a rapid weight gain or rapid reduction, it tells you a lot too. But you want to make sure that you notice any changes in yourself and you're reporting these to your physician. These are ways for you to be proactive about your care, and you can make sure that you're sharing enough information so your team of healthcare providers are making the best recommendations for you. So I've talked about journaling before, and I'd just like to ask, is anyone out there journaling? And if you're not, that's something I would encourage you to do. Now, I talked about nutrition. So you want to make sure that you're tracking your meals, and sometimes it's so important to get help with planning your meals, but journaling that, talking to your physician about what foods to avoid is so important. Your physician may recommend a low sodium diet, which means it's low in salt. That might be to help you to control your blood pressure and reduce your water retention. You might need a diet low in protein, which has an effect on your kidneys. Protein can have an effect on your kidney. Or he may put you specifically on a renal diet, which limits your intake of sodium, phosphorus, and protein. Again, there is no lupus diet. There are specific foods that your physician may recommend for you or may ask you to stay away from. And having that conversation about your nutrition is very important. So again, this is from our Facebook page. One of our visitors said, keep a log of your symptoms. Also says, watch what you eat and drink, and when there's a symptom, be sure to log what you've eaten so that you can track your flares. That's very, very important. So I kind of touched on this a little bit earlier about taking some time for you. You want to reflect on your experiences. Sometimes it's important to just ask a question, how is lupus? If you are a lupus caregiver, you might want to ask the question, how is lupus impacting your life on a daily basis? Asking that to your loved ones. Also, are there any particular areas in your body you're concerned about? Do you have any concerns about organ damage? Well, when we talk about in journaling, it's so very important. I'm going to go back here for a moment and start at the top when it says to take some time for yourself. Sometimes our stress level gets up. And one of the things that we want to remember to do is ways that we can help reduce that stress. And one of the things that we can do is something as simple as taking the time to take a couple of deep breaths to relax. So let's do that. Let's take a good deep breath in and blow it out. One more time. Good deep breath in and blow it out. That's a simple exercise when life gets stressful that we just might need to do. Some people count to 10. But if you focus on your breathing, sometimes that's able to take your mind off of what tension you had or what was stressing you for the moment. Now let's talk about communication, open communication with your healthcare team. One of the things that I like to emphasize for you is that you are the captain of your team. I know a lot of times we give that power away, but you're really the captain of your team because it takes you being present for your physician to take care of you, make any type of recommendations for your caregivers to be there. You're the captain. Now, sometimes you might need a co-captain to remember to ask the questions that you may forget, but just remember, any concern that you have, ask the question to your doctor. Any changes that you feel like you need to make in order for your kidneys to be at the highest function or you to maintain a stable weight. You want to talk to your doctor about any kind of diet that's having an effect on you. And knowing what steps you need to take to monitor your kidneys is so important also. So some of the tests that you can take, your healthcare provider, you need to have a conversation with them about this if there's any concerns. But they may do a urine test to check for proteins. They also may draw blood to see what your urine, your kidney function is looking like when they draw your blood. They're looking at, I know it's medical terms, but BUNs and creatinines and the ratios for there. But those are some of the tests that they may run. And also, if they think that you're having some dysfunction in your kidneys, they may want to do a kidney biopsy to check for scarring and inflammation in your kidneys. That will also help them to classify what level, if you are at having some kidney disease, what level you're at, and let you know what next steps you should be taking. So when we think about your health care team, one of the things that I know is it can be a big team. We have so many allergists that may be a part of your team. And when I say allergists, I mean your rheumatologist, nephrologist, cardiologist, gastroenterologist, dermatologist. There's so many here. Endocrinologists. There's so many ologists, studies of science is what ologist is for. That may be a part of your team, and keeping those straight, what appointment is what day. It's hard to do, so having your co-captain is important when we start talking about doctor's appointments and the importance of following up. Also, it's so important sometimes to keep medication straight, knowing what your treatment plan is, but we know that your treatment plan is personalized. You may be on a variety of medications, anti-inflammatories, you may be on corticosteroids, you may be on an immunosuppressor, an ACE inhibitor. There's so many different medications that you could possibly be on, and having that conversation with your physician and your co-captain, as you will, to help you make sure you're keeping them straight and making sure you're taking those medications as prescribed. And if there's something that you're taking that's not working well, so that you can have that conversation with your physician and let them know that something's not working well for you. Okay? So you want to also, when you're being an engaged and informed patient, it's so important for you to stay informed. You want to continue to learn about lupus, learn as much as you can about lupus, any of the researchers out there, follow up about symptoms and treatment plans, follow up about any complications that you might be able to recognize in regards to lupus nephritis. There are so many resources that are available to you. LSI webpage has a wealth of information that you can do. You can also go to the lupus.org webpage, the rheumatology.org webpage, and even kidney.org. And we have our webpage, usinlupus.com. We do it as one word, but Us in Lupus is another strong resource for you. So this is our QR codes. I asked each of you guys to get out your cell phones and turn your camera on. So I'll give you a moment to do that. Grab your cell phones and turn the camera on and point your camera at one of these 4 QR codes, which you may be more interested in learning after the call tonight. This takes you straight to our usinlupus.com webpage, and it gives you specifics about common lupus signs, about lupus nephritis, the basics about lupus, and even symptom tracking. So something should come up immediately, and you don't have to take a picture. If you just hold it up, it should allow you to go straight to that webpage. And so it'll take you to it. If it doesn't take you right over to the usinlupus.com webpage, if you type it in your web browser, in your computer, or even on your browser on your phone, it should take you to that webpage. And with that, I'm going to stop here, Lisa, and pass it back to you. Tell you thank you for allowing me to speak to your group tonight, and open it up for any questions.
All right. Wow. Thanks, Aliciee. That was a lot of great information. So I know that probably is a lot for everyone to take in. But if you do have any questions, throw them up in the chat, or any comments or anything that you'd like to ask. We do have about 15 minutes left.
So hi, my name is Torian Jackson. For those of you who know me, I'm the office coordinator for the LSI office. I'm also the volunteer coordinator, and I actually do have some questions. You mentioned before about the lupus fog. So if a person who experiences these lupus fog, what do they experience any long-term damage?
That can be, and that's contingent on the individual. Because a lot of times when you're experiencing lupus fog, that's a neurological impact that it's having. And so, you know, as I mentioned before, when you're having neurological lupus is affecting you neurologically, it means you could be having little mini seizures, you could have many strokes, you can be having headaches. So depending on the severity of that lupus fog, determines whether or not it's a long-term impact or not. But that's something that is a better question for you to ask with your physician, and let them do a neurological assessment of you to determine what your baseline is, where you are, and doing a comparative a comparison of it at a later time. So they might want to do it if they do it now and then again in 6 months.
Great. So you mentioned that the importance of nutrition and exercise, but how also important it is to make sure that you're psychologically able to tackle on lupus?
Oh, that's very important. And that's one of the things when it comes to lupus, having the support system. And that means your immediate family and support system, your lupus family is your support system. All of these people are very, very important in helping you be as mentally healthy as strong. Because we know lupus is a challenging disease, and being able to persevere each and every day is a challenge. And so the psychological impact of lupus is very important. So, the question would be, do you have the support system that you need? And that's not one I would want you to answer here, but just throwing it out there. Do you have the support system that you need? And if you're not, is there someone that you can reach out to, maybe even at LSI, that they can put you in contact with, a support group that you can contact and be on calls with, attend meetings when we go back face to face?
All right, thank you for that. But we also got another question. Does the lupus sometimes cause brain freeze, as in like when you eat something cold?
That's interesting. That's a really good question. I've never heard of lupus causing a brain freeze, so I don't really know the answer to that. One of your peers may be able to relate to that, but I've never heard of that.
I had a question come to me. Why is lupus nephritis more common in men?
Yeah, great question. We think the reason why lupus nephritis is more common in men because men don't go to the doctor as often, and a lot of times they've had lupus for a while before they've been diagnosed, and therefore the disease has progressed.
And we got another question. Actually, they want to know what were the blood tests that you take again.
Well, there's several your doctor may order. I just named two of the most simple ones, which is drawing blood for your BUN and creatinine levels. That just tells you if those numbers are high, which has an impact on your kidney.
And speaking of kidney, what will probably be the best practice for trying to maintain a healthy kidney, like trying to make sure your kidney is in a stable place before you get to you need dialysis?
Yeah, now that's a tough question, and that's actually a conversation that would be good for you to have with your physician. Diet is part of it, which includes your fluid intake, and so that's one of the conversations that you would need to have with your physician about. Because you'd have to know what's impacting the dysfunction of your kidney. Is it you have high blood pressure? Is it your kidneys are not functioning properly for another reason? Those are all the things that your physician would need to determine.
Now, I know that people who have kidney problems, that often sometimes will be put on water pills in order to help drain some of the fluid that may enter their body. So when trying to make sure that you check regularly for your urine, does being put on water pills, would that cause some type of a confusion or misleading results when they're testing?
So you're talking about a diuretic. That's what we often refer to as a water pill. And if you're on a water pill, as you said, your physician has prescribed that, and they're taking all of that into consideration when they're evaluating your results.
All right, so one other question. So lupus will sometimes cause to have your blood pressure to go up. Now, when that happens, will their feet itch as well?
Will the feet itch?
Yes.
Not sure about that one. That's something that I haven't heard. It might be a symptom specifically to one person or to a few people, but that's not something I'm aware of. So I would ask you to speak with your physician about that also.
Now, sometimes with people, I know exercise is very important, but there are some people, because of their lupus, are unable to really exercise. So, what would you say for those type of people? How would you advise them
Yeah.
to try to get moving, or how would you advise them when in a situation like that?
Yeah, that's another good question. And so the first piece of advice I would always give before taking on any activity is consulting with your physician. And by consulting with your physician, he may refer you to a physical therapist. And if he doesn't, that might be something you may ask for. And a physical therapist may be able to, or will be able to, give you some recommendations on exercises that's appropriate for your particular situation.
Now, we just got another question that actually goes back to the previous one. We have a lupus patient who's experiencing itchy palms. So, is that something that that the lupus also causes?
Yeah, and again, I would send you back to your physician on that. That's not something that I'm familiar with, and so I would encourage you to talk to your physician about it.
Aliciee, I have a question about journaling. So I know most lupus patients see their doctors probably quarterly. If they're journaling and like they're writing down, they're drinking water, and then they start noticing some of those symptoms, either urinating more or the foam, or they feel their blood pressure, is there like a recommended time, like to maybe call and try to get an earlier appointment, or at what point do you recommend that they like check in if it's, you know, a month after their appointment and they don't have one scheduled, you know, for 2 months?
Yeah, my recommendation, that's a great question, Lisa. My recommendation is, if you notice a change and it's something new, you would want to call your physician's office and speak with the nurse, leave that information with them, and then you would get the advice of your physician whether he wants you to come in or not. But you can always, when you have any concerns, you can always call the office, ask to speak to the nurse. You may have to leave a message for her, but they always listen to the messages at the end of each business day. And from there, they can determine whether or not you need to come in to be seen sooner than your next appointment.
Okay.
Now, is there a certain amount of water that a person with lupus need to drink?
Yeah, that's a question that I would not answer. That's one I would say speak with your physician about. Depending on your particular situation, that may change per person. The average recommended amount of water per day for anyone without a health condition is 8 glasses of water. That may be too much for you. It may not be enough for you, but that's a discussion that I would recommend you having with your physician, because he would be able to look at your kidney function, your overall health, and determine whether that's a good recommendation or not.
Now, do symptoms of lupus normally get worse as you get older, or does it usually mellow out?
Wow. Yeah, that's a good question. And that's an individual thing. Remember, I started by saying that lupus is a fingerprint disease or a squirrely disease. It's kind of all over. People progress with lupus differently. Some people are able to get their disease into what's called remission and it not progress. Some people, lupus shows itself and continues to get worse and worse. And sometimes you may start with just outward, like a rash or something, or swelling of your joints or something, and you might have only had that for years, and then all of a sudden you have another symptom show up. And so the progression of it is individualized.
Now, are there any nutritional supplements or vitamins that would be beneficial to take every day to help with lupus?
Yeah, and so that, again, that's a question that I would refer back to your physician.
All right. So has statistics changed on men with lupus from 20 years ago? Is it still about 10% diagnosed?
Yes, it's still 10% of men, one man in every 10 people are diagnosed.
And can lupus flares increase during certain menstrual cycle times?
That's a good question. What I would say about that, just having listened to different lupus patients, I've had many people say that their menstrual cycle is more severe than what an average person experiencing when they've compared to siblings or friends or whatever. And one of the things that I've heard other people living with lupus is that most of the time when they experience some type of sickness, what's considered to be average for, like, I'm not diagnosed with lupus, what's an average common cold for me may run the course of 3 days. A lot of times with people living with lupus may experience 6 or even 9 days. It's usually a longer course and most of the time more severe than what the average person sees.
Okay, I think that's about all the questions that are coming in. Well, I'll give people a few more minutes in case they wanted to get their questions in the chat or email. But I just want to say thank you so much for doing this, Aliciee.
You're welcome.
Aliciee, this is Charles Brummel.
Hey, Charles.
How are you?
Great. And yourself?
Yeah, so thank you so very much for hosting this this webinar this evening. As usual, you're providing outstanding information. I was just jotting down some notes as I listened to you, and you raised so many very important points. I hope those who are in attendance will take the time to look at this again, because we'll put it on our our website. I think hearing it one time probably is not enough, because there's a lot of information that you provide. One thing I did want to say and dovetail off of what you were talking about in terms of maintaining a journal is that the information in that journal, the patient should take with them when they go see their doctor.
Yes.
And depending on who the doctor is, each doctor is different. But I know in the case of in my family, we give that information to the doctor. It includes how the blood pressure's been doing and all kinds of things. And they normally appreciate it because it allows them to have a better understanding of how the patient is doing.
Yes.
So I just wanted to mention that. So anyway, thank you very much for being here tonight.
Thank you.
So we got one additional question. Is lupus nephritis generic? Someone in their family has lupus, and she wants to know is is it generic? Like, can you just go for family member?
Yeah. Very good question again. And so we know that lupus in general has a genetic component. What we haven't figured out yet with lupus is just the trail of it, if you will. What I mean by that is we can't say that because your mother has it, your daughter has it, or because your father has it, the son will have it, or it skips different generations. What we know that there is a genetic component to it as one of them, but we are not able to track the relationship of it yet. And so not necessarily when it comes to lupus nephritis, we know, again, there's a genetic component, but I can't say just because one family member had lupus nephritis means that another will.
Okay. I believe that's all the questions we have.
Okay, great. Well, thank you for allowing me to come tonight. It's been very inactive. I like getting the questions, and I hope I've answered them and left something for you to take back to your physician also.
All right. Well, thank you, Aliciee, again, and thank you for everyone who participated. And like we mentioned at the beginning, this was recorded. So if you missed something or you have we'll get this posted in the next week or so. But if you have any questions or want additional information, please reach out. You can email me at lisa@lupusil.org, and we'll make sure to follow up with Aliciee. So thanks again, everyone, and we hope to see you all soon. Have a good night.
All right, take care.
Take care.